Welcome to Configuring Electronic Health Records, Building Order Sets. The component Configuring Electronic Health Records provides a practical experience with a laboratory component utilizing the Vista for Education program that will address approaches to assessing, selecting, and configuring electronic health records, EHRs, to meet the specific needs of customers and end users. This lecture examines the value of order sets and goes through lab exercises designed to instruct on how to build order sets within a typical EHR. Normally, the order sets would be created by clinicians with expertise in treatment plans. Clinical application coordinators would be able to take those plans and put them into specific order sets within the EHR system. Two definitions of order sets are collections of preformed orders and groups of orders to manage a disease state or for a procedure. It is recognized that a major portion of patient care planning occurs during the process of writing orders. Computerized order entry can present collections of predefined orders to the clinician during the ordering process, thus speeding up the process while also reducing the opportunity for errors in creating the orders. These order sets are also useful for promoting standards of care and provide one element of structured clinical knowledge when using computerized provider order entry, CPOE systems, at the point of care. It is important to note that confirmation and maintenance of order sets is resource-intensive. However, sharing order sets is a useful and desirable goal. There are several benefits of order sets. The use of order sets is familiar to most clinicians, and most healthcare organizations have pre-printed order sets in use. In fact, standardized order sets consisting of predefined collections of orders addressing particular patient treatment scenarios have been established for many common processes for medical, surgical, and procedural problems. In short, order sets are a tool to translate evidence-based clinical knowledge into actions at the point of care. Effective order sets support error reduction, quality improvement, and reduced healthcare process variability. Predefined care plans detailing the essential steps in the treatment of patients with well-defined clinical problems are designed to translate published guidelines into local workflow. From a practical perspective, using quick orders and order sets for frequently ordered items can significantly speed up the ordering process for clinicians. Several quick orders can be combined in an order set, and order sets enable a group of quick orders to be executed in a sequence without having to select and create each order individually. There are significant time and expert resource costs associated with order sets. Although the incorporation of order sets into CPOE systems is a powerful tool to support implementation of standard care plans, reduce errors, and guide clinicians to utilize best practices in their care planning sessions, it is also time-consuming to create, manage, update, and distribute a large collection of predefined orders and order sets. In addition, this process requires clinical expertise and must incorporate the most current research to ensure best practices are in place. Authoring order sets is often a local process, requiring custom development and programming that involves the time of a number of people with expert knowledge and skills. Typically, an EHR will provide specific tools for authoring and displaying order sets created for local use to ease the development burden and improve turnaround time. Healthcare organizations commonly have a number of standardized order sets implemented across the organization. However, the value of having nationally developed order sets for common disease states or procedures is also recognized. Currently, there is interest and dialogue around creating standard representations of order sets that in turn will support the maintenance, sharing, and interoperation of predefined order sets amongst healthcare providers. This concludes building order sets. In summary, it is clear that the implementation of effective order sets is an essential tool in configuring EHRs to meet the standards of meaningful use. Order sets directly impact patient safety, quality of care, and efficiency of treatment. Coordination of care is supported through the implementation of broadly recognized best practices, which, in turn, will indirectly impact the health status of populations by providing the best treatments and reducing errors or oversights.